Hello guys, it is medical information, and in this session I want to talk about knee osteoarthritis. Knee osteoarthritis happens when the articular cartilage is destructed or damaged due to the erosion and overuse. The cartilage by itself won't make any pain because cartilage has not nerve endings, but the peripheral tissues such as the muscle, the joint capsule or the bone have pain sensors which can cause severe and even excruciating pain in knee osteoarthritis. Knee osteoarthritis has several risk factors. For example, older age is the most important risk factor for knee osteoarthritis. The second risk factor is severe obesity or morbid obesity. Also, with increasing body weight, the risk of the knee osteoarthritis will increase. Also, the abnormal knee, for example, the varus deformity or the bony is associated with a higher risk of knee osteoarthritis. Also, the knock knee or the valgus deformity is associated with a higher risk of knee osteoarthritis. The difference is that valgus deformity or the knock knee can cause erosion in the lateral surface of the knee, but the bow leg or the varus deformity can cause erosion in the medial side of the knee. Being a professional runner is associated with osteoarthritis of knee and hip, but an amateur runner is exposed to a higher risk of just hip osteoarthritis. Being a minor is associated with higher risk of knee osteoarthritis, and also the minors will undergo a higher risk of low back pain. What happens in knee osteoarthritis leads to joint space narrowing. You can see in the left side there is a normal joint space and it's symmetrical, but in the right side the joint space has been asymmetrically decreased, and you can also observe osteophyte formation or subchondral sclerosis and subchondral cyst formation. What are the treatment of knee osteoarthritis? Knee osteoarthritis is primarily treated with acetaminophen, and in severe cases acetaminophen won't alleviate the pain, and drugs with more potency and more effective drugs are needed. For example, naproxen, diclofenac, which are stronger in decreasing the pain, but there is also a higher risk of gastrointestinal bleeding with naproxen or diclofenac or other drugs such in the group of non-steroidal anti-inflammatory drugs. In more severe cases, corticosteroids can be injected into the affected joint, and it can decrease the pain for example 1 month, 2 months, or even longer, but repeated doses are needed and it can be effective for too long. In those who are experiencing excruciating pain and they can tolerate the drugs, or the drugs are ineffective, total knee replacement with prosthesis are recommended. The surgery can be effective for about 10 to 15 years, but there is a substantial risk of complications, for example infections, bleeding, or needing to a revision surgery, and the patient must also go through a lifestyle modification. If you enjoyed this video, please don't forget to like, comment and subscribe. See you soon.